o'clock. I'm gonna come in, gather my equipment, wash my hands, and then provide for privacy. Hi, my name's Hannah. I'm gonna be your student nurse today. Could you give me your name and date of birth? Check the wristband, it looks good. So today I'm just gonna be cleaning your wound and giving you a fresh dressing. My patient's bed is in the lowest locked position. They're wearing non-slip footwear. Call light is within reach. There are no trip or fall hazards anywhere. So first I'm just gonna check the provider order and any policies that I need to follow, and it looks good. And now I'm gonna come over here and teach my patient about the procedure. So I'm gonna remove your old dressing, and then I'm gonna inspect your wound for any infections, make sure it's healing properly. I'm also gonna measure it, and then I'm going to clean it and put a new dressing on for you. Do you have any questions? Okay, awesome. On a scale of 0 to 10, 0 being no pain, 10 being the worst pain, what would you rate your pain right now? About a 2, okay. And I'm gonna make sure are you in a comfortable position? Okay, you're covered up nicely here. And then I'm gonna come over here. I'm going to wash my hands and put on some gloves. Alright, and then to remove this wound, or the bandage, I'm gonna use the push-pull method to be as careful as possible to not rip any of the patient's skin or hairs. Should be as careful as I can here. And then I'm going to assess the dirty bandage for any odors or redness or drainage, and it's looking good, so we're going to discard that per hospital policy, whatever that may be. We're going to do the same with the gauze here, also looking good, so we are going to also discard that. And then we're going to come over here. The wound, this redness on the outside is normal with healing, so that's good. The edges and margins are approximated nicely. It's not too beefy red or anything like that. It's not feeling hot or anything. Patient's not in very much pain, so that is also good. Now we're going to measure the wound. So if I take this, it looks like it is about 14 centimeters long and about 2 centimeters wide. Then I'm going to take this cotton applicator here. I'm going to stick it in there, and then right there, that is going to be about 2 centimeters as well. I'm going to discard that, and then I'm going to take my gloves off, wash my hands, and then I am going to prepare my equipment while maintaining a sterile field. I'm going to open this here. Pour some saline in there. And now I'm going to wash my hands. I'm also going to do this tape here. wash my hands again. And put some gloves on. Now we are ready to clean the wound. From this gauze here, we're gonna lift up the 4 corners and not touch the middle, because the middle is gonna be what we clean. So I'm gonna start with the center of the wound here. We're also going to do 1 swipe per gauze pad and discard them in between. And we're gonna do the sides of the wound as well on the inside. Alright, and then we're going to do the para wound on the outside. And get that other side here. And at this time, if any medications were ordered, I would administer them using the 3 checks and 11 rights, but there were no medications ordered, so we are all good with that. Now I'm going to discard my gloves and wash my hands again. Now I'm going to put on some new gloves. Alright, and then there wasn't much fluid or drainage in the wound there, so I'm only going to be using 1 piece of gauze here. I'm just going to pack the wound in here like that. Looks very nice. And then I will take the abdominal bandage, put that on top like so, and then we will use the tape doing the window pane method when putting it on, so it stays on nice and securely. Might have to expose the patient for a second at the bottom here, but then just cover him back up. Alright, and then I'm going to remove my gloves once again. Wash my hands. Then I'm going to initial and date and time. And then after that, I would thank my patient and be sure to document the wound change and assess for any changes or anything like that afterwards. Thank you.